Hi guys, welcome back to my YouTube channel. Let me use this opportunity to thank those who newly subscribed to my YouTube channel. I appreciate you. Thank you. And if you have not subscribed to my channel, I wonder what you are still waiting for. Please subscribe, okay, and tap on the bell. Very important for you to be notified anytime I upload a video. So I have a wonderful gift at the end of this video that I'm going to show you guys. Today's topic is all about postpartum care. You know, the journey to motherhood is not a child's play. So after 9 months, the wahala and the labor, the day of your delivery, another wahala, then comes up your postpartum period. And what is this postpartum period? It is a period after childbirth. Immediately you put to bed, then you are in your postpartum period. So there are certain things that is required for you to do as you are taking care of your baby. You ought to take good care of yourself, physically and emotionally. So this postpartum period lasts for 6 weeks. So what are you going to expect during this period? The first thing is immediately you put to bed, you start experiencing what is called lochia. And lochia, it is the bleeding of and discharge that come out from your womb through your vagina. So it lasts for about 14 weeks or more, depending on your body system. So, and it is required that you take good care of yourself during this period. And one thing to do, the first thing to do is to put on your pad so that to absorb the blood. You won't be stained with blood. Then this pad is needed to be changing in every 2 hours daily to prevent infection. Then for mamas who deliver through the vagina, most mothers deliver easily without episiotomy. Then some deliver with episiotomy. So for those who deliver with episiotomy, which is an incision that is made at the entry of your vagina to ease childbirth. So for you, there are certain things you need to do to hasten the healing and to ease pain, because it's usually painful. Okay, then one thing you need to do is please take the anesthetic that is recommended to you by your doctor or physician. It helps to relieve pain, especially ibuprofen. Then another thing again is, in some hospital they will give you an ointment that you need to be applying on the area of your incision. Don't just keep it at home. Please be doing these things, because it will help to hasten the healing and relieve pain. Another thing you need to do is keeping the area clean. In case you use the toilet or you take your bath, you have to use a clean towel to wipe and clean that area. All these things are to be done to prevent the area from being infected. And again, even if you don't need to stay one place that you are feeling pain, let me stay one place. it is advised that you have to be moving around. In fact, if you want to sit despite the pain, you have to sit as you usually sit even before you gave birth or before the incision was made, so that you cannot have some one kind step after the healing. So another thing again is you have to be taking your sit bath. This sit bath is sitting in a warm water. For this, we relieve pain and hasten the healing. The another thing you can do if you don't want to have sit bath is sitting on a steam evolving from a hot water. So in fact, this very method of sitting on a steam evolving from a hot water is very effective, because it will get rid of some residue or clotted blood in your uterus and hasten the blood flow to prevent the clotted blood staying in your womb. So after these things I'm saying is very effective. It's not just mercy, it is very effective. So this episiotomy needed a very good care. Like I've mentioned them, so you need to be doing this or applying this method to hasten the healing and relieve pain, because it is usually painful. Then there are other things that you will expect as a new mother. One of the things I've said, it's bleeding. Then another thing, you will have tenderness of the vagina, which is as a result of the episiotomy and or any other tear that baby may have given you, whatever. So then another thing again is contraction of your uterus, because your uterus is coming to a normal shape. So there is usually a contraction that sometimes pain or sometimes we give you a mild pain, very mild one. So this contraction, you have to be expecting it. It's usually come up anytime you are breastfeeding your baby. It's more severe, I mean it's more painful then, but not every mother experience such. So another thing is breast engorgement. Breast engorgement happens within 1 week, 7 days of the arrival of your baby. That your breast will be so painful and be so full and heavy. So these are normal things, but for in case if you, that is why you'll be advised to be giving your breast milk to your baby regularly, constantly, or even if your baby may have full, you have to be pumping your breast, because when it's occupied there for a longer time without giving it out to your baby, it can lead to infection. Yes, because when it accumulates there for long and it's not being passed out, you didn't release it out, it will accumulate and lead to what some yeast infection. So all these things, to prevent such infection, you have to be raising your breast milk. Then be putting on your supportive bra. This also will prevent much engorgement. So another thing you are expected to have is fatigue, that is overtiredness. A new mother experiences it is a normal thing. So another thing you are expected to experience, but in most women, is constipation. Constipation usually occurs in most women, so it is advised that you take much of fiber food and vegetable and fruit to help to soften your stool when you are passing it out. And emotional care. There is what you call baby blue in postpartum period. This usually happens to every new mother. So this postpartum and this baby blue, the symptoms include you are going to be feeling irritable, being impatient, crying for no known reason, feeling disappointed, anxiety, sadness, bad mood. All these things are baby blue, but they usually go away with times. They usually go away. Then the prolonged and severe form of this baby blue is what we call postpartum depression. You know, some women experience such. You know, there is some weird behavior that we do see from a new mother. Then you now begin to ask what is happening. You start at a certain period. We do hear some strange story about mother killing their baby, mother throwing away their baby, mother dumping their baby, and all sorts of this strange story. But science have made it clear that all these are symptoms of postpartum depression. Symptoms include hopelessness, sadness, memory loss, fear of harming your baby or yourself, over concern or lack of interest to your baby, low self-esteem, confusion, lack of concentration, and fatigue and exhaustion. So all these things are symptoms of postpartum depression, and like I said, it is a prolonged stage of baby blue, just like some story we used to hear about mother abandoning their baby, or sometimes a new mother, after some months or after some weeks, the person starts acting weird, as if he's going mentally in fact, as if he's going insane. So all these things are as a result of postpartum depression. So now, what are the causes of this? Though scientifically there is no proof to prove the cause of these things, but it is considered that there are certain conditions and situations that can lead to this postpartum depression, such as when there is problem in marriage between the couple. This can lead to postpartum depression. Another thing is hormonal imbalance due to hormonal changes during before birth and after birth. So it's considered that hormonal imbalances can lead to postpartum depression. So another thing that can lead to this, that can cause this, is lack of love from family, from friends, and around you. Lack of love and support can cause this postpartum depression. So now I have to advise some family who maybe their daughter got pregnant out of wedlock. So instead of harming your child and the grandchild, please, I know the mistake has been done, has been made. So show love and support the child who has gotten pregnant out of wedlock, so that to prevent such omen of hearing so many stories about girls throwing their baby and dumping their baby, because maybe the parent or the family member has been throwing so many insults upon their child, and all these things. We are human beings and we have emotions. So because of this, the baby may have, the girl child may have gotten pregnant and managed to stay and carry that baby up to 9 months. But at a time when she delivered the baby, maybe that baby blue, and remembering the sort of let's support our children or our daughters who mistakenly got pregnant out of wedlock. so that these stories of throwing baby, dumping them, and postpartum depression can be reduced or minimized. So at this juncture, I am ending this video. So thank you for watching, and please subscribe to this channel if you have not. Bye.
Subscribe, like and share.